A new study from Columbia University's School of Public Health found that anti-gay stigma significantly shortens the lifespans of people who identify as gay, lesbian, or bisexual. This is incredible, and it's really, really sad. The study compared LGBT people who lived in communities with a lot of anti-gay prejudice to those who lived in the most welcoming communities, and found that those in the stigmatizing communities had a shorter life expectancy by an average of 12 years. That's a big difference. The study compared data on prejudicial attitudes from the General Social Survey with mortality data from the National Death Index over the 20-year period from 1988 to 2008. And by the end of the study, 92% of LGB residents in the low prejudice communities were still living, but only 78% in the high prejudice communities were still living. So the distinction correlated with substantially elevated rates of suicide, homicide, violence, and cardiovascular disease in the high prejudice community. And according to the researchers, other variables were controlled for, so there's no other explanation for these results. You know, on the one hand, this is like mind-blowing because it's such a big difference. Average of 12 years less when a gay person lives in a community that stigmatizes gay people. Like, that's a huge difference. But on the other hand, another response I had was, well, stress kills. And if you live in a place that you're on edge and you're tense and you're feeling stress all day, every day, yeah, that's going to cut your life short, man. That's a killer. That's deadly. But I guess the extent is the part that it's hard to wrap your mind around. So, look, we make fun and we joke and we mock when we do segments of Brian Fisher or Pat Robertson or John Hagee or, Mr. X Republican politician bashing gay people and saying ridiculous things and comparing it to pedophilia and all this crazy nonsense. But really, at its core, this is dangerous. It's dangerous, and it's immoral, and it's unethical, and it's wrong, and it's incorrect, and I can't say enough bad words about it.